When we are very happy or sad, tears roll down. But even in normal conditions, there is a layer of tear on the surface of the eye, and this gives us excellent quality of vision. For those in whom this thin layer of tear is either missing or unhealthy, a disease called as dry eye comes. Dry eye can be very irritating and also can cause visual blurring. Let us see what this dry eye is, how to prevent it, and how to take care of it.
Dry eye affects millions of people worldwide. It is one of the most common reasons that patients visit their eye doctor. Our tears are a complex mixture of water, oils, and mucus. When vision is healthy, a balance exists between the tear layers. If an imbalance occurs with one or more of the tear layers, the tear system breaks down and dry spots develop. This is called dry eye and occurs due to insufficient production of tears or excessive evaporation of the tear film. Dry eyes are uncomfortable and can impact vision throughout the day. Patients who suffer from chronic dry eye find it difficult to perform everyday activities, which can significantly decrease their quality of life. Dry eyes occur from a number of different reasons. These include age, gender, medications, and environmental conditions. Other factors include long-term contact lens use and refractive procedures such as LASIK, which can cause decreased tear production. The key to managing dry eye is to recognize the symptoms early and seek treatment from an eye care professional. Without treatment, chronic dry eye can lead to impaired vision, eye infections, and scarring. During this test, a tiny tear sample is measured from both eyes and the osmolarity number is generated for each eye. Based on your readings, your doctor can determine whether you have dry eye disease and if so, whether you fall in the mild, moderate, or severe category. This will aid your doctor in the development of the appropriate treatment regimen to bring the ocular surface and tear filled back to good health. Ask your doctor about the tear osmolarity test today. In order to determine if you have a dry eye, your doctor may perform one or more tests to assess your vision. One simple test for dry eye disease is called a tear osmolarity test. This test measures the salt content of your tears, which is a major indicator of dry eye disease. The tear osmolarity test has been shown to have the best predictive value for diagnosing dry eye disease of any single test. One simple test for dry eye is called the Schirmer test. The Schirmer test is used to measure the amount of tears made by the patient's eyes. For this test, a well-striped filter paper is placed over the lower eyelid at the edge of the eye after numbing drops are given. After a few minutes, the paper absorbs the tears from the eye and the amount of wetting is measured in millimeters. If the amount of wetting measure is less than a certain amount, it may indicate the presence of dry eye.
By taking precautions and following the advice that's given by the doctor, you can certainly defeat the dry eye and have an excellent quality of vision and a very comfortable eyes. Also, take care of the environment. Pollution is one of the main causes of increasing dry eyes these days.